Second white coat. Subscribe and like. Let's learn medicine together.
All right, let's jump right into a really fascinating medical mystery. We're going to solve this one together. And it all starts with something you've seen a million times, a kid's accident. But the clues, well, they lead us down a very specific and pretty surprising path. So let's get into it.
So, picture this. We've got an 11-year-old boy. He's up in a tree, he slips, and as he's falling, he does what any of us would do. He shoots his left hand out and grabs a branch to try and stop himself. He actually lands on his feet, didn't hit his head, didn't pass out. At first glance, he seems totally fine, but a few hours later, his parents bring him to the hospital because something is definitely wrong.
Okay, so every good mystery needs clues, right? And this case has two really crucial ones. We're going to look at how he fell, and then we're going to look at what his symptoms are. And by putting those two together, we can figure out what's really going on here.
So clue number one is the action itself. Think about it. Grabbing that branch while his entire body weight was falling created this sudden, violent upward yank on his whole arm. This isn't just a simple sprain. That upward pull, or traction, puts a really unique kind of stress on that whole bundle of nerves running from his neck down into his arm. Honestly, this action is our smoking gun.
And now for our second clue, the symptoms. And this is where it gets really specific. He's not complaining about his shoulder. He can lift his arm just fine. Nope, it's all happening in his hand. He says it feels clumsy, and he's having a hard time with small movements, like buttoning a shirt. But here's the kicker. The weakness is only in the intrinsic hand muscles, those tiny little muscles that are actually inside the hand. His bicep? Totally fine. His shoulder? Working perfectly. It's just his hand.
Okay, so we've got our clues. A big upward pull on the arm and weakness only in the small muscles of the hand. Now the real investigation starts. To connect these two things, we need a map of the crime scene. And that map is a little thing called the brachial plexus.
And here it is. Now I know this looks like a complicated plate of spaghetti, but just think of it as the main electrical junction box for the entire arm. You've got nerves coming out of the spine and the neck, and then they weave together in this crazy pattern before they shoot off to control every single muscle from your shoulder all the way down to your fingertips.
Now remember our first clue, that upward yank? This is where it gets so important. That specific movement doesn't just stretch this whole network evenly. No way. It puts almost all of the tension on the lowest nerve roots coming out of the spine. We're talking specifically about C8 and T1. You can see them right here, at the very bottom of the whole complex.
Now just watch what happens next. If you follow those two roots, C8 and T1, see how they almost immediately merge together? They form one bigger nerve bundle, kind of like two small roads merging onto a major highway. And that highway has a name, the inferior trunk. So that fall didn't just stretch C8 and T1, it damaged this spot right here. This is ground zero for our injury.
And this is the aha moment. This is where it all connects. Where do the nerve fibers traveling along that inferior trunk highway end up? Well, they travel all the way down the arm and they become huge parts of the median and ulnar nerves. And what do those two nerves control? You guessed it. They control pretty much all of the intrinsic muscles of the hand, the very muscles that aren't working right for our patient. So let's just recap our logic here. Step 1. The fall created an upward pull, which immediately pointed us to the lower part of the brachial plexus. Step 2, the weakness was super specific, only in the intrinsic hand muscles. And step 3, we traced the nerve pathway for those muscles all the way back to C8 and T1, which come together to form the inferior trunk. All the evidence points to one tiny spot.
And hey, just to be thorough, let's rule some other things out. If he had a typical shoulder injury, he'd have trouble lifting his arm out to the side, right? We don't see that. If he'd broken his arm bone, the humerus, we'd expect something like wrist drop, where he can't lift his wrist up. We don't see that either. The only diagnosis that perfectly explains this specific pattern of clumsiness and weakness is an injury to the inferior trunk. It's a perfect match.
So we've followed the clues, we've looked at the map, we've pinpointed the exact location of the damage. And this combination, this specific cause and this specific set of symptoms is so classic that doctors gave it a name a long time ago.
So, after all our detective work, what's the final diagnosis? What do we call this thing? It's called Klumpke Palsy. And what is that? Well, it's defined as an injury to the inferior trunk of the brachial plexus, hitting those C8 and T1 nerve roots. And the classic sign is weakness or even paralysis of those little intrinsic muscles of the hand. Our medical mystery is officially solved.
Okay, so what are the big things to take away from this case? Let's just boil it all down to 3 simple rules you can tuck away in your brain.
First off,
From now on, anytime you hear a story about a forceful upward pull on an arm, like grabbing a branch or someone being pulled up by their arm, your brain should immediately snap to one location, the inferior trunk of the brachial plexus.
Second, whenever you see symptoms that are all about clumsiness and weakness in those small, deep hand muscles, you should be thinking about the C8 and T1 nerve fibers. That's their territory. They're the ones that handle all that fine motor control. And finally, the diagnosis itself. Just put the two together and it becomes a simple equation. Klumpke's palsy equals an inferior trunk injury. It's that direct.
So we cracked the case of the boy who fell from the tree. And that just leaves me with one last question for you. Now that you know the exact mechanism here, what other situations, maybe in sports or at work or even other types of accidents, can you think of that could create that same exact upward pull on an arm and put someone at risk for a Klumpke palsy? Something to think about. Thanks for joining me.